Human metapneumovirus, or HMPV for short, might sound like a mouthful, but it's a virus that deserves our attention. This virus is part of the Paramyxoviridae family, which also includes other well-known viruses like the measles and mumps. Despite its relatively recent discovery, HMPV has been circulating in human populations for decades, if not longer. Discovered in 2001, HMPV is a common respiratory virus that infects people of all ages. It was first identified by a team of Dutch scientists who were investigating respiratory illnesses in children. Since then, it has been recognized as a significant cause of respiratory infections worldwide. Think of it as a relative of the flu and RSV, causing similar cold-like symptoms, especially in young children. These symptoms can include a runny nose, cough, sore throat and fever. In some cases, it can also lead to wheezing and difficulty breathing, which can be particularly concerning for parents. While HMPV infections are common, most people experience mild cold-like symptoms and recover fully. However, the virus can be more severe in certain populations. For instance, individuals with underlying health conditions, such as asthma or chronic obstructive pulmonary disease, COPD, may experience more intense symptoms. However, for some, particularly infants, older adults, and those with weakened immune systems, HMPV can lead to more serious respiratory illnesses like bronchiolitis and pneumonia. These complications can require hospitalization and, in severe cases, can be life-threatening. Understanding HMPV is crucial for protecting ourselves and our loved ones. By being aware of the virus and its potential impact, we can take steps to minimize the risk of infection. This includes practicing good hygiene, such as regular hand washing and using hand sanitizers, especially during the cold and flu season. Recognizing its symptoms, knowing how it spreads, and taking preventive measures can significantly reduce the risk of infection and its potential complications. HMPV spreads through respiratory droplets when an infected person coughs or sneezes, so it's important to cover your mouth and nose and avoid close contact with sick individuals. In the following sections, we will delve deeper into the world of HMPV, exploring its symptoms, risks, and prevention strategies to help you stay informed and healthy. By understanding this virus better, we can all contribute to a healthier community and protect those who are most vulnerable. Human metapneumovirus, often abbreviated as HMPV, is a master of disguise, frequently mimicking the symptoms of the common cold. This virus is part of the Paramyxoviridae family and is known to cause respiratory infections in people of all ages. This can make it tricky to diagnose based on symptoms alone, as it shares many characteristics with other respiratory illnesses. However, being aware of the typical signs of HMPV can help you seek timely medical attention, especially for vulnerable individuals such as young children, the elderly, and those with compromised immune systems. The most common symptoms of HMPV resemble those of a cold and include a runny nose, which can be persistent and bothersome. Other frequent symptoms are a cough, which can range from mild to severe, a sore throat that can make swallowing uncomfortable, and fever, which is the body's natural response to fighting off the infection. These symptoms usually appear gradually, starting mild and potentially worsening over a few days. It's important to monitor the progression of these symptoms, as they can sometimes lead to more serious conditions. In infants and young children, HMPV might manifest as croup, characterized by a barking cough and difficulty breathing. This can be particularly distressing for both the child and the parents. In more severe cases, HMPV can progress to bronchiolitis, an inflammation of the small airways in the lungs which can cause wheezing and difficulty breathing. Or it can lead to pneumonia, an infection of the lungs that can cause chest pain, severe cough, and difficulty breathing. These conditions may require the hospitalization and can be particularly dangerous for those with underlying health conditions such as asthma, heart disease, or weakened immune systems. If you or your child experience any of these symptoms, especially if they worsen or persist for an extended period, it's essential to consult a healthcare professional. Early intervention can prevent complications and ensure appropriate treatment. Early detection and appropriate management can significantly improve outcomes and reduce the risk of complications. By staying informed and vigilant, you can help protect yourself and your loved ones from the potentially severe effects of HMPV. Understanding the structure of a virus is like knowing your enemy. It allows scientists to develop targeted treatments and vaccines. So what does HMPV look like under a microscope? HMPV belongs to a family of viruses called Paramyxoviridae, which are known for their single-stranded RNA genomes. Picture it as a tiny sphere, much smaller than a human hair, encased in a lipid envelope. Protruding from this envelope are two types of glycoproteins, like tiny spikes, the fusion F protein and the attachment G protein. The F protein acts like a key, allowing the virus to fuse with our cells and release its genetic material. The G protein, on the other hand, helps the virus attach to the cells lining our respiratory tract. By studying these proteins and their roles in viral entry, scientists are exploring ways to block HMPV from infecting our cells. This knowledge is crucial for developing effective vaccines and antiviral therapies. Section 4. Vulnerable populations. Who's most at risk from HMPV? While HMPV can infect anyone, certain groups are more susceptible to severe illness. Infants, especially those born prematurely or with underlying lung or heart conditions, are at the highest risk. Their immune systems are still developing, making them more vulnerable to respiratory infections. Older adults, particularly those with weakened immune systems or chronic health problems like heart or lung disease, are also at increased risk. As we age, our immune response weakens, making us more susceptible to infections and complications. Individuals with compromised immune systems, such as those undergoing chemotherapy or living with HIV, are also highly vulnerable. Their weakened defenses make it difficult to fight off infections, making them prone to severe HMPV illness. Recognizing these vulnerable populations is crucial for implementing targeted prevention strategies. Vaccination efforts, when available, should prioritize these groups to minimize the risk of severe HMPV infections. Section 5. The spreading menace. How HMPV travels. HMPV is highly contagious and spreads easily from person to person. The virus lurks in respiratory secretions like saliva and mucus and takes flight through coughs and sneezes. Imagine this. An infected person coughs, releasing tiny droplets laden with the virus into the air. These droplets can travel up to 6 feet, potentially infecting anyone within their path. But HMPV is also a master of stealth. It can survive on surfaces like toys, doorknobs, and countertops for several hours. Touching a contaminated surface and then touching your eyes, nose, or mouth can unknowingly transmit the virus. This is why hand hygiene is paramount in preventing the spread of HMPV. Frequent hand washing with soap and water or using an alcohol-based hand sanitizer can significantly reduce the risk of infection. Section 6. Familiar foes, HMPV versus RSV and the flu. HMPV often gets overshadowed by its more infamous cousins, RSV and the flu. These viruses are well known in the medical community and among the general public due to their widespread impact and the significant health challenges they pose each year. However, it's important to remember that HMPV can be just as troublesome, especially for vulnerable individuals. This includes the elderly, young children, and those with weakened immune systems, who are at a higher risk of severe illness. All three viruses share a knack for causing respiratory illnesses, making it difficult to distinguish them based on symptoms alone. This similarity often leads to confusion and misdiagnosis, complicating treatment efforts. They often cause similar symptoms such as cough, runny nose, fever, and wheezing. These overlapping symptoms can make it challenging for healthcare providers to identify the exact virus without specific testing. However, there are subtle differences. Recognizing these differences is crucial for accurate diagnosis and effective treatment. RSV tends to affect younger children more severely, often causing bronchiolitis. This condition leads to inflammation and congestion in the small airways of the lung, making it difficult for young children to breathe. The flu, on the other hand, can strike at any age and is known for its sudden onset of high fever, body aches, and fatigue. These symptoms can be debilitating, leading to significant time off work or school and, in severe cases, hospitalization. While treatments for all three viruses mainly focus on managing symptoms, there are effective vaccines available for the flu. These vaccines are updated annually to match the most common strains and are a key tool in preventing widespread outbreaks. Unfortunately, no vaccines are currently available for HMPV and RSV, although research is ongoing. Scientists are working tirelessly to develop vaccines that could provide protection against these viruses in the future. Understanding the similarities and differences between these viruses can help healthcare providers make accurate diagnoses and recommend appropriate treatment strategies. This knowledge is essential for managing patient care effectively and reducing the burden of respiratory illnesses on the healthcare system.